I'd just like to run through what I call the do's and don'ts of being a visitor. There's no way you're going to just barge in by yourself. If you said, look, go and see Mrs. Jones in room 7, and you go there and you find she's sound asleep, I wouldn't wake her up just to talk to her. I might go somewhere else and come back later on to see if she's still asleep. But I think if a person's sound asleep, they're probably doing them more good than we could do. The confidentiality issue is a very important one, that when you talk to people in a context of their illness or whatever it might be, they often say things to you that they might not say to other people. And if in fact you wanted just to sort of talk generally about, I went to the hospital today and I visited a patient, and this patient's had very severe problems and I got on well talking to her. I don't think there's anything wrong with that, but for heaven's sake, never mention who it is. Because if something trickles back to someone about something that they've said to you which you've repeated to someone else, that's the end of it. That's the end of it. So confidentiality is a very, very important issue.
This is a copy of the policy about confidentiality that was given to everybody.
What's its main features?
Okay, so it's talking about, so all employees, volunteers and contractors at OPH will ensure that the use of any information relating to patients, staff members and admin actions that is not in the public domain will only be used for authorised work-related purposes. And that talks about disclosure of any information obtained in the course of employment or work in the case of a volunteer or contractor will only be permitted to other authorised users. So basically, meaning that you information you learn about the patients, you can't be talking to other people about that. That's right. Yeah. For example, if it was your information, say if I'd seen you and you told me things and then I was at a restaurant and having we were talking about century eggs and I tell them about this person and that, and then they know you and it's just, so it's not professional, not appropriate conduct. We will obviously, staff will share information about the patients to you in your volunteering capacity because you need to know the background history about that person. But only that information that needs to be, contained to the work you do.
It's like it applies to all of us who work here. Even if, let's say, we had an amazing situation in a hospital or really fascinating emergency, and I go home and I want to share, I will never mention names. Anything would identify that patient. So we have to keep it, and the same with you. As you said, you wouldn't like anyone else to know about it. It's just between you and the person.
That's right.
I think we've stressed that listening is the main thing to do, and I don't know whether any of us today have really been 100% listeners. We wanted to involve ourselves in the conversation, which is good, but be careful that you don't let listening be submerged under talking. Does that make sense? Yes. Listening is the most important thing, so that people understand that you do listen and you care about them to that extent. Now, observation, there's already been mentioned about observation, about body language. It can be misinterpreted, of course. Somebody might sit like this and you say to yourself, my goodness, they're really uptight, aren't they? In fact, they're cold. So don't jump to conclusions about what body language is about unless it's very, if a person's you're talking to and they can constantly turn their head away, it's a pretty good indication. Either they've got a stiff neck or they don't in fact want to keep eye contact with you. So that can become a bit significant if if the body language is I mean, if a person suddenly pulled the bedclothes over their head, I think it'd be about time you left, because they're giving a pretty good signal that they want you to go away. So observation is important, but don't jump to conclusions about what it might mean. You've got to put it in the context of what's also being said, so that the things go together. Clarifying. If what you hear coming out from the person is anxiety or depression or frustration or anger, then to clarify, I really have picked up that you're pretty angry about this, or I really feel I can sense your anxiety, or something like that. You're clarifying and you're showing, I really do, I'm trying at least to understand this person. And that's the most helpful thing. If a person feels that they're being understood, that's really a bonus for them. So the clarifying. And sometimes you can summarise. And by that I mean that you have listened to what a person is saying to you, and in order to show that you do understand, you try to make a little bit of a summary about what you've heard. I mean, I can hear that you're very anxious not only about being in hospital and not knowing what the outcome for you will be, but also I can hear you being quite anxious about what it's going to be like when you go home. Now that's a sort of a summary of what you've heard. Now, it's not everything that you've heard, but at least that seems to you to be the central sort of issue that's coming out to you.
In other words, we repeat what has been said to us.
You don't repeat exactly,
no,
but
not exactly, but
you
summarise. Yes.
Paraphrase what you've heard. It's not easy always to do that, because sometimes you get such a massive information tossed at you, you don't know which is the most significant one. But it's worth having a try. But leave it as an open issue. I know that you're very anxious. It's not the thing to say. No. But I've picked up that you sound pretty anxious, and it gives the person the chance to say, now hang on a minute. It's not just anxiety, it's I'm really frustrated. Right? Or I'm a bit lost or confused or whatever else it might be. If you're going to ask questions, ask relevant questions. I suppose I'm trying to think of an example about that. If a person's talking to you about their anxieties and everything else, and you say to them, what's the food like? That's not very relevant at that point. And all they pick up is that you're trying to steer the conversation away from something which is making you feel uncomfortable. So make sure that if you're going to ask questions that they are relevant to what the person's saying. Maintain eye contact. That's important too. It's a bit hard if the person's swivelling their head around, but normally, if you're talking to someone, try to maintain eye contact with them. That's the beauty of sitting down, because you're on the same level as the person rather than looking down at them. It's nice to be able to give somebody something when you leave. That does raise the question too, are the people going to have a badge?
Yeah.
You've got there,
like
it's got their name on it.
Name and photo.
Yeah. So that's important to have that as well. Know when to leave. It's a good. It comes with experience when you pick up the vibes. Is that the word that the people have had enough of you, or they're tired, they want to go to sleep, or even that you're tired yourself, and that you're beginning to sort of repeat things that you've already said. And you know it's time to knock off and go. And so politely you say, well, it's been lovely talking to you, and perhaps see you later, or something like that.
And sometimes don't feel like you are so boring and they're falling to sleep when you're talking, because often they had their physio and OT and they had the lunch and they're all feeling the same. So don't take it personally. Yeah, it's simply the day. The activities they
So what do? You say?
I just disappear and come back another day.
Knowing your limits as well, which goes hand in hand with what you're saying about knowing your own energy levels and maybe taking a break if you're seeing 2 patients in one day. Take a break in between.
There's another aspect to this that I haven't touched on at all, but I think it's important. Just for a moment, imagine that you go to see someone and their story is so harrowing. You know, it's really got an incredible quantity of sadness about it and so on. I think it's important to have somebody on the staff to actually, in a sense, unload that to, not carry it home with you. I have a problem with some of the things that I see on television. There was the one the other night about the trial in India of the medical student who was raped by 6 people in a bus and died afterwards. I lay awake a good deal of the night trying to deal with what I'd seen and heard. And sometimes that happens too when you actually, if you're in a situation where you've been talking to or dealing with somebody whose story is just so terrible, you really need to be able to, if you're able to share it with somebody, of somebody who's not going to breach confidentiality, and that's why I think it would be in the circle of the hospital, that's helpful. Don't put it this way, don't let yourself carry unnecessary burdens of other people's problems. There's enough. Most of us have got enough to carry for ourselves without carrying other people's as well.
And we often do it with staff as well. When we have emergency, and we recently had one, and the nurse was crying, she was really sad what happened, she was blaming herself for what happened, so we had to do the debrief with her, because of course we get affected on the things what's happening on the ward, and you might be the same as they've said, and we don't want you to go home and be sad and cry and get depressed yourself. So maybe we should, as I said, we'll be here when you be on the ward, so come to us, talk to us about it and any issues you may have.
And with the patient, and the patient is unloading all the misery, terror and all, how do you react? Say I'm a visitor, do I show sympathy or how do I go about it? I listen to all these and then come out and share with one of you so that, you know, I feel lighter when I go home.
Of course, you have to be empathetic.
But with a patient who is telling you all these things, how do you respond? You just listen.
As I said, it's very personal as well, and we all probably get different response.
And quite intuitive too. I guess it's quite intuitive, listening to what's going on, and you're assessing what their issues are, and
you're a bit like a psychologist in a way, because you're working with another human being and they're all different, and you will have to sense them and simply be empathetic, but don't go too deep in that, like they've said. Keep the boundaries.
You have one tremendous advantage, of course, and that is that you have in fact had the same experience of being in the bed and being a patient and so on. Keep a record of the visit, because you might come back, and if it's important to see them again, well, you've got a bit of a note about it, you know.
But I would encourage you guys, if you want, maybe just keep a bit of record, like how many visits you had. Maybe you find out after a few weeks, I'm doing too many, I'm really tired, I can't do it. So instead of quitting this and saying, I'm not going there anymore, I'm too exhausted, come and tell us, look, instead of 3 or 4 people at a time, give me 2 or 1. And that'll be still okay.
And initially, you know, as you're finding your feet, I would see it that you'll probably meet either Kathy is the other social worker on the ward, maybe meet with myself or Kathy, depending on Eleanor how busy you are, but after the visit. So, you know, initially while you're finding your feet, do a visit, have a chat with us afterwards.
And you may even, but if you say, let's say, oh, you visit someone and you think, I would really like to see that patient again and he or she is willing to see me, let us know so we do the same, you know. It would be nice to continue as well, because they probably got the trust in you by that point.
Well, we come a bit to the don'ts. Don't stand over the patient if you can sit down.
Can I just add about when you're sitting down? So in the hospitals, we're not supposed to sit on the beds, so to sit on a chair rather than on the patient's bed. And if you need the chair moved, ask a staff member. We certainly don't want any of you hurting your back. Pulling out chairs are actually quite heavy, so just ask someone and we can move a chair. And I guess what I've learned too after like 15 years of doing this kind of thing is make sure you're comfortable for your own back and posture. If you're sitting potentially for half an hour with someone, if you're sitting in an awkward position, you will end up with a sore neck and back. So, be front on.
Eye.
Hey?
The patient will be eye in the bed.
Sometimes, most often patients are sat in their chairs when I see them. They're up out of bed. But there is, and if someone is shorter than you or hunched over, there is a tendency to make eye contact, but you will end up with a sore neck. So make sure you're comfortable. Just a practical tip there, and avoid sitting on the beds.
How do you cope with the fact you've been asked to see a patient in room 4A and there's somebody in 4B?
We just pull this.
You've got a curtain,
and
but
there's
they
no
can't
way
help.
around.
They can't help overhearing the conversation.
I know. Yeah.
They do.
And I think that's nice to maybe ask the patient if they want to go outside and speak somewhere else more private.
Well,
or even, how it got on the corridor outside the sofas.
The couches.
Yes.
The couches, you could take them there as well. So.
don't give advice about medicines or medical matters. Whatever you do, don't. I suppose it's possible you might say to a person, I've been taking a pill lately and it's been very good. And it could go quite contrary to what the other advice they've been given and so on. So keep away from things like even saying, I found that this is very good for me or something like that. No, I'd leave all those things to let the medical staff. Never say to a person, if I were you, this is what I would do. It's not, you're not the other person, and it's a phrase that often gets used, If I were you, I'd go to that dentist rather than that dentist. They mean well. If I were you, I would buy a Holden rather than, really. But don't ever do it with the patient, because it's a way of giving advice, isn't it? That if I were you, I'd do that. Or don't make the session be about your experiences, although we found that that's very important, that they do know a bit about your experiences so they can relate to you, but not to dominate, as we've talked before. Or make decisions for the patient, and that was the one that came up about when we were talking about finding help perhaps for a person. Don't make decisions, or in that sense, don't give advice, because you could be treading on other people's toes as well, and you could be dead wrong. I've done it. Become an advocate. Don't become an advocate. Now, it's so easy to do this. And I think I might have mentioned before that we lost one of our visitors at Charlie Gardner Hospital, who was an ex-nurse. And she became an advocate for the patient by going to the nursing staff and saying, I think you're treating this patient in the wrong manner. And I think that at that stage they felt that she was just interfering with the place and so on. So don't become an advocate, because you don't normally know all the circumstances anyhow. Don't offer false reassurance. I think I mentioned this before, that the famous phrase, I'm sure you'll be all right. Dear, I cringe every time I hear that phrase being used, because you don't know that they're going to be all right. You can say, I hope you're going to be all right. That's fine. But not I know that you'll be all right. No, please, not that. Don't be judgmental about lifestyles. You might find that a person's had a stroke and that they've been a heavy smoker. You may be tempted to say to the person, aren't you sorry now that you smoked so much? Not very helpful at that point. Or, and that sort of thing that does happen, go on. And don't promise to make a follow-up telephone call unless you really think that it's important to do so. It might even be unethical to do so. Sometimes it may be appropriate to do so, but I would discuss it with this. Mrs. Jones has asked me, would I ring her brother and say, next time he comes to visit, would he please bring me this or that or something else? Now, that's a pretty straightforward request, but I wouldn't do it without going to the nursing staff and saying, why is Mrs. Jones asking me to do it, rather than asking somebody in the hospital to do it? It may be that somebody in the hospital said they would and they didn't. That's a possibility. It may be that it might carry more weight with the brother if a visitor does it. There's all sorts of ways in which you can get your fingers burnt by taking on things that you shouldn't. Don't offer to do things for people or do them unless you're quite satisfied it is the ethical and appropriate thing to do.
And in that case, we'd be advising people to ring either our doctors or our nurse if they have any.
Yeah, if they have that, yes.
You know, any medical things.
And then the last bit I've got down here is we talked about it before. Everybody needs someone to whom they can relate, a sort of supervisor, or who might make their task to regularly have a meeting of the volunteers. So that you can talk about your experiences and learn from one another.
And just keep communicating with us, saying, look, Michelle, I feel a bit uncomfortable with this, or I'm not clear about that, and you know, we'd rather that than you maybe just don't come back, you know, have a bad experience and just, I'm not doing that again. And I guess we want it to be as fun and rewarding as possible for you, you know, as much as it will benefit the patients on the ward, you know, hopefully you'll find it meaningful and purposeful too.